I'm really excited to invite Sarra today to speak. She is a community connector, I believe that's right, sometimes called a social prescriber,
Yeah,
depends which day
that's
of the
right.
week it is. I'll hand over in a second. Sarra very kindly has been supporting a GP practice in 19 Hills for, has it been a year now already,
Yeah,
Sarra?
just over a year. Yeah.
God, wow, okay. And obviously across the rest of the UK and internationally, there's a long track record of inviting colleagues from agencies outside the NHS to help us with patients that doctors and nurses and NHS and clinical staff don't always have the tools or the experience or the skills or connection to know what to do with. This could be on community connections, this could be kind of other forms of community support, it could be housing. I don't want to do too much injustice to kind of rob Sarah the opportunity to talk about all the great work she's been doing. But given this has been a kind support we've had from Newport City Council to our GP practice in Ringland at 19 Hills, we thought what a great opportunity after about 12 months to really showcase some of the outcomes, really. Sarra is joining from her phone. I know that Zoom isn't universally appreciated likes by the public sector. Thank you to everyone that's managed to get on in the end. I'm sorry for the tech issue with Eventbrite. This will be being recorded. If you want to share the link with colleagues afterwards, please do. And as it's a webinar, the setup very much is just to kind of keep the flow going. If you've got a question, if you've got a comment, if you've got a kind of observation, reflection, please pop it in the chat. I'll give you a bit of a cue in a second of how to do that. We should be wrapping up by 12:40, so you don't want to eat too much into everyone's lunch break. I appreciate we have done already. Sarah's got a presentation. I'm going to do the slides in true Chief Medical Officer. Next slide, please. That will be my role today. And hopefully this will all work very smoothly and we'll get some time for questions and discussion at the end. Is that okay, Sarah, if I start to hit share?
Yes, please. I'll let you know when to change slides if that's okay.
Let me know, Sarah, if you can see that.
Yes.
Lovely. Over to you.
I mean, that's it. Perfect. Thank you. So I'm just going to turn my screen just so I can see that it's bigger. There we go. Can you hear me properly?
Loud and clear.
Perfect. Okay. So hello, everybody. My name is Sarra Thompson and I'm the social prescriber based within Ringland Medical Practice. So as Johnny has just said, I've been working in this role now for just over 12 months. And prior to this, I was working within the Community Connector team and working with individuals all over the Newport area. So most of you may know the role of a social prescriber, but for those who don't, my role is to work with patients registered at Ringland Medical Practice to improve their health and wellbeing by connecting them to non-medical support that is available in the community. So if you can change the slide, please. I'm just going off my slides on my laptop as well, so I can keep up to date. So yeah, place-based care, and as I say, based within Ringland Medical Practice. I'm CCG funded until the 2026, and at the moment my work pattern is 4 days per week, equaling 30 hours. I'm allocated a room within Ringland on Wednesdays and Thursdays from 2 p.m. till 4:30 p.m. So how does it work? The patient will present at the GP practice with anxiety, stress, low mood. The GP clinician will recognise that it's a non-medical cause for condition, such as social isolation, loneliness, housing or debt issues. The clinician will then refer over to the community connector team, which is where then I will pick up the referral. So the connector, which is myself, will contact the patient to discuss reasons for the referral and arrange a wellbeing appointment. At the appointment, we'll have a heart of the matter conversation, and a heart of the matter conversation can identify the root causes of issues or problems that the patient may be facing. So what I often find is that once having this conversation, the reason for the referral is not actually the presenting need. So for example, they may be low and down, but the reason for this could be that they're socially isolated. Maybe they're worried about their housing situation, or maybe they're an unpaid carer and they're at breaking point. So having the conversation can help build rapport and confidence, and we can then explore non-medical support that can help towards maximising social and support networks available to them. So the aim is that it's targeted, preventative signposting and early intervention support, and hopefully to reduce the need for escalation to primary care and or social care. Next slide, please. Thank you. So here is the presenting need and referral outcome activity. Since creating this slide, I have worked with more patients, so some data will have changed. So as you can see, 29 unpaid carers were identified, and I've had involvement with patients from the ages of 13 to 98. The top 10 reasons for referrals are, so anxiety and stress, autism support or additional needs, benefits such as debt, finances, PIP, bereavement and grief, family or carer support, health support groups such as dementia, housing issues, loneliness and social isolation, mental health or low mood, mobility aids such as adaptations and blue badges. As you can see, the box on the right is the number of patients who's received specific outcomes. So 22 patients will have benefited from information to tackle their social isolation. 10 patients will have received IAA on bereavement support, and so on. Next slide, please. Here's the reflection of the previous table. So as you can see, the theme that we are noticing at the moment is that financial support, anxiety and stress are the highest factors, and closely followed by mental health and so on. Next slide. Okay. So on the left, you can see the Community Connectors directory. So the Community Connector team, they will have compiled, or they have compiled, a directory of groups and services available across the Newport area. So there's a range of information within the directory, such as social groups, wellbeing support, information on Dementia Hub, carers groups, and a lot more. These directories are given to the patients that I work with. And then on the right, you can see some of the services that I have referred and signposted my patients to. So such as Age Cymru Help at Home services, you've got bereavement support, financial support such as Citizens Advice, parental support, and support with loneliness such as Chatty Cafe, men's groups and the veteran groups, etc. Next slide, please. Here's a case study. I just thought it was good to showcase really that one person may come in for one piece of support, but actually there may be many positive outcomes for one individual. So this person was referred to me whilst she wanted support whilst waiting for support from Women's Aid. The patient had expressed that she was struggling with mental health due to many life events, and she was waiting for counselling and mental health support for past trauma and sexual abuse. Whilst having the heart of the matter conversation, it was identified that she was a single parent to 2 children and had an unpaid caring role for her young daughter who had additional learning needs. Whilst at the face-to-face appointment, I was able to conduct a carer's assessment to identify strengths and support and any support that she may have needed, such as in this case, she was behind with her rent and she was in debt. I was able to apply, excuse me, I was able to apply for a carer support fund grant through Newport City Council, and the application was successful. She was able to receive a voucher, a £100 shopping voucher and a £100 Love to Shop voucher. Following this, there was discussions around schooling, and this resulted in a space panel referral for parental support. We discussed her housing issues and a referral was made over to the Housing Support Gateway team. We spoke about her finances, where then she received support from the cost of living team to maximise her income, alongside a referral to Riverside Advice for further advice around her benefits and debt management. After this, then, the patient started to attend the Carers Cafe for peer support from community connectors and to help reduce her social isolation. Next slide, please. Again, here is a list of service providers. So once having contact with the patient, I will do my research and engage with services that may be suitable for the patient's outcome. Referrals will then be made accordingly. So again, just some of the services may be, the Family Information Service, Violence Against Women Support Team. We've got Citizens Advice, Women's Aid, Trussell Trust, and Riverside Advice. Next slide, please. So some of the success factors: integrated health and social care delivery and partnership, multi-agency collaboration, motivational uptake prescribed by GP to explore non-medical options, mapping, so developing signposting resources and directories, and positive patient and clinician feedback. So at the bottom is a comment made by a professional, and it says, amazing how this social prescribing project demonstrates such a wide-ranging demographic from young to old, and the varied preventative outcomes met for these patients. The project shows the diverse needs for our communities. You have had positive feedback from our MDTs. Next slide, please. Here is some patient feedback. I won't go through them all. I'll just pick a few. But thank you for seeing me. You have gave me a reason to get dressed today. I left my appointment with you feeling less stressed and lighter. I've been worried, but speaking to you has been the highlight of my day. Next slide, please. So, although I only work with patients registered at Ringland Medical Practice, anyone living in the Newport area can have support and speak with a community connector for information, advice and assistance. So if you are working with somebody who you think may benefit from information on what is available in the community, you can refer them over to the community connector team via a referral form. And members of the public can also self-refer. So I hope I've given you an insight about my role today, and I am happy to answer any questions. Thank you.
Thank you, Sarah. That was absolutely brilliant. Fantastic to time. And I just want to say it's been it's a real privilege to hear you give that feedback from what the patients and some of the community have said in and amongst the the contacts you've had with them. I mean, because of course that's always kind of one of the things that we talk about really is kind of how do we get that feedback, how do we capture and what is it GPs want to know and what is it the NHS clinicians need to know really. And I'm sure everybody would agree that it's heartening to hear the massive considerable benefit and support that you've invested into people. So just on behalf of our patients, I think, Sarah, thank you so much. I didn't want to interrupt the flow of the webinar too much. I'll take the screen off share.
Thank you.
There is a facility if people want to start to ask some questions now. So, we've got a good 10-15 minutes left for anybody. If anybody's clearly very keen and want to say anything really, then I think there is a facility we could invite you to share your screen and audio to, recognising we've got some other colleagues from the council, Newport City Council on the call, but no pressure at all. So guys, if you want to ask a question, it's the Q&A box you want to look for. I think it's at the lower hand of your screen. Everybody should be able to see all the questions now. I'll kick off. I don't like chair of a meeting taking the prerogative to ask the first question, really. But if no one else does, then someone has to, don't we? So what do you think the support's been like from the GP practice to you and your role, and what could we learn from that going forward if this was done in Ringland as a practice or in other practices too?
I think for me, the support that I have received has been absolutely crucial. Obviously, coming from a social background, as in isolation, is completely different to health, and it often links in. So having the support from you guys is a must, really, especially down to services such as like the mental health team from you guys. The only services that I really know would be Mind, and so yeah, for me, I think it's a must. Yeah.
Is there anything you think, I mean, I know it's difficult at a webinar really for you to kind of say, oh, we would have done this differently. I didn't really work at all, really, So it's maybe not the time. I appreciate it. It's maybe not the time, but um, you don't always appreciate from the fantastic, wonderful slides you've put out there and all the data and the numbers and the qualitative kind of evidence and the comments and the feedback. But the people we can be talking about can be leading some very difficult lives
Absolutely.
sometimes, can't they? And they can have some things in their lives or going on in their lives, or they can have some things really, about them, conditions that it can make this quite complex at
Hmm.
times, really. I just wonder if you've got any kind of thoughts or comments
I think
on
what's
that.
been obviously it's very new still, and obviously only being 12 months in, I'm still learning a hell of a lot at the moment still. For me, having support with knowing how the MDT meetings work and being able to see who's on the MDT lists, obviously then we can make sure there's no duplication in work. And just the back and forth really of sharing that information and knowledge about patients in order to get the patients to the best. Sorry, my screen's changing. For the best outcome. Yeah, I think that kind of thing is really important. I've also had meetings now with I think it's Karen and Jenna. They're looking at
Mhm.
doing the open access, the
Right?
drop-in
Yeah,
in Ringland. And we're trying to work how, again, we can work with each other in order to get the best outcome for our patients so that they're not waiting around for another
true.
service to get involved. And so, yeah, there's still a lot of learning, but I think the more collaboration, the better.
Brilliant. Our strategy of me talking at you until other people start to ask questions is starting to pay off, Sarah, really. So you're not free yet. Sorry, I know, you're doing really well. One of our colleagues or partners has asked a question, Sarah, do you hold a caseload? And if so, how long would you tend to keep people on your caseload for?
So, yes, I have a caseload. I'm the only person within Ringland Medical Practice. So again, I work from bottom to top. So whoever comes in first, I'll work with first. However, um, yeah, what I am finding, so for example, the case study, I'll have some people come in and straight away they need help maybe with their PIP application form, and that's as far as it goes. I can refer straight over to the services that can support with that. However, there are some people, when you have the heart of the matter conversation, there is a lot to pick apart and there are a lot of outcomes, which can be very overwhelming for that individual. For example, the case study that I used, there were so many outcomes for that individual. I asked her, where do you want to start first? Because it's just too much for one person to take. That's when we started with the CARES assessment and the space panel. So, although it's difficult to say how long I can keep one person, because it does depend on the amount of outcomes and the amount of mapping and back and forth with services that I need to do. If I don't know whether that really answers the question.
It does. So really, I guess there's no hard and fast rules for these things, really, to
No,
the extent if there wasn't flexibility in the role and flexibility in the service, then it wouldn't work. And that's probably why we need roles like these that have flexibility, because
yeah,
so many other services are quite inflexible at times, really.
hmm,
Obviously, I'm just speaking about the NHS. I'm not speaking about any
yeah,
other public sector services at
yeah,
all. Lovely. Okay. Well, thank you for that question. I hope it does answer it. If you don't feel it does, then come back and let us know more. We've got another question. They're coming in thick and fast now. What is the MDT that you've spoken about, Sarah? Can you expand on that a little bit?
Is it multi? You're gonna have to help me with this one.
I think it
Multi.
does stand for multidisciplinary team. Yeah. Yeah.
Yeah. So can you explain how it works your end, and then I can explain how it goes in
I
because
should
I
do.
don't
Yeah, I
know
should
the
do.
functions your side either.
In Newport. We're talking about the east of Newport now initially, but I do gather that this is somewhat similar in other kind of parts of an Iron Bevan and Gwent, particularly Newport West. Place-based care. Sorry, you're anonymous, so I'm going to have to call you anonymous. Place-based care is a project that's supported by Iron Bevan University Health Board. Primary care, which is GP practices, but also other community services, including dentistry, opticians, pharmacy, many, many others. It's organized into what we call networks or clusters. So it's basically trying to get lots of people working kind of collaboratively across a kind of neighborhood or kind of geographical basis to get more partnership, to get more collaboration, but also to kind of do things at a broader, larger level that is sometimes kind of tricky to do if you're in kind of a small practice, working alone. The cluster, the network, I need to stop talking too much now, don't I? The cluster, the network funds projects, and one of them is place-based care, which has a team that basically oversees, for most, if not all, GP practices now in east of Newport, a fortnightly multidisciplinary team meeting. There's an MDT coordinator, there's some support staff attached to that, and each GP practice is invited to bring to that fortnightly meeting patients that we're worried about, we're not quite sure what to do about, or we want to have a conversation with another service, which could be within the NHS, like your district nurses, or it might be actually that just for one patient, we say to that patient, look, we know this other service is really involved in your care. It could be health visiting, it could be speech and language therapy, it could be a podiatrist, it could be a social worker, it could be anybody. We just would love to have a conversation with them in the short time we have to kind of think how we work together, but pool resources, I guess. Do you think that makes sense, Sarah?
Yeah,
And obviously,
definitely.
handing over to you, the great thing we have is that with this fortnightly meeting, when the district nurses join, GP practice joins, other colleagues and partners join too. This MDT meeting, sorry, this multidisciplinary team meeting now knows that we have extra support in Ringland Medical Practice, because sadly yet not all GP practices have a Sarah, maybe one day. But they can suggest after the meeting takes place, if it hasn't happened already, I appreciate sometimes it has, let's offer this person an appointment with our community connector, with Sarah, to give more support, really. And likewise, Sarah can bring people to the MDT. Do you think I've described that properly,
Yeah,
Sarah?
definitely.
Lovely. Okay. Let's try and get through some more. Norman has asked Sarah, how would their charity delivering health and wellbeing projects in Newport be able to become a partner? I guess we're talking about community connectors here. Norman asks this as they've been delivering projects for 12 years in Newport, not had any success engaging people at 19 Hills. Sorry for that, Norman, approach us separately. During the past 6 weeks with their Fit Fans, it's a free 35 to 65-year-old health and wellbeing program. Any thoughts, Sarah, on how we could make that thrive?
So, just wondering, have you had any involvement with the community connector team? Because if this is so with the directory that the community connectors have put together, there are so many groups and services that are running within the Newport area. And at one point we had a directory that was so big and we had thousands of details of different groups and services. But the moment that you put that out there, information has already changed. So we've obviously, basically made the directory smaller with groups that we know are running that this is sustainable and going to keep running. I don't know whether it'd be worth you touching base with the community connectors, because if they know of your group, me included, and then when they speak to individuals in the community, that is definitely information that they can hand out to them in hope to build your numbers.
I think that's perfect, Sarah. And apologies, Norman, that's my bad. We should have prefaced this webinar with 19 Hills Kick as an independent, community-based social enterprise, independent of the health board, independent of the council, independent of Ringland Medical Practice, there to support the community, work with the community, engage community on what the community wants to see happening in the 19 Hills area, which is Alway electoral neighbourhood ward, and also Ringland. The health board maintains the facility, the 19 Hills Health and Wellbeing Centre. So if there's anything you want to get on in the Wellbeing Centre itself, That's a health board question. I can pass the details across separately. But Sarah's absolutely hit the nail on the head. If you would like to anything to be promoted, the more that we know what's happening, the better.
Absolutely.
The more that we know that what's been offered, the community want to do, I guess, too, is the other kind of side of the equation. But that's perhaps that's a separate conversation to have afterwards, Norman. I hope that's helped. Let's try and get through them all. Question again: do you work, Sarah, with the place-based care team who run that place-based care MDT we talked about a second ago? I guess the answer is yes, in short. Really.
Yeah, yeah, yeah.
Any comments or reflections on that?
Um,
Really, because
so for me again, I'm still trying to learn everybody. It's very, even though I'm still a community connector, my links are a lot different. Obviously to avoid duplication and to ensure that the patient's not waiting or, sat waiting here, there, and everywhere. So the more links for me, the better. Like I say, I'm still in contact now with Jenna and Karen, which is a new link for me. So if there is anyone that you think I should link in with to better support my patients, absolutely, yeah, give me a shout.
knowledge and intelligence is key. That's great. Thank you. Mandy, I know that you were next in line, but I'm going to come back to yours last if that's okay, because I think the questions might be starting to stop, and I think that'd be a good place to end. So there's a final question then. We've got Sarah, have you had social prescriber training? Do you know if there's a plan to have more of you across other practices? We need to clone you, they're saying. We need to clone you.
That's not something that I know. Obviously, I think it's down to funding and things as to
Yeah.
having me in other places. Bellevue Surgery do have a social prescriber, Hina Talkani. As for other surgeries, that's not something I'm really certain on. As I say, it depends on management and the funding and things. As for social prescribing training, information, advice, and assistance all sits within the community connector team. So that's something I've been doing now for 8 or 9 years. So apart from linking in with health professionals, my role hasn't really changed.
I think it's fair to say you probably need to train us, Sarah, don't you? Because this is bread and butter work for you guys,
We
really,
can
all the
work
kind of
together,
social
it's
side of
fine.
things, really. What I would just add, if it's okay, Sarah, I hope you don't mind me butting in, really. But Welsh Government didn't long ago actually publish their national framework for social prescribing. I think social prescribing has been quite a thing across other parts of the UK for quite a considerable period of time, and at a national level, quite a lot of money and resources has been put into social prescribing, whether you feel it should be or not. And although the framework, I want to say it was end of 2023, it was finally published. A lot of work done by Professor Carolyn Wallace, who some people might know of, a professor at University of South Wales, directs the Welsh School of Social Prescribing Research, and there's lots of work at a national level there. I mentioned Professor Wallace because one of her researchers and colleagues actually did our first webinar doing some pilot engagement work, trying to kind of train up people in the community as residents to kind of lead peer focus group conversations on what services could do differently coming into the new building, which is a cheeky signpost. People can go back and listen to that one. But there is work to look at what the funding and commissioning and kind of planning is going into this. Are there enough social prescribers, community connectors? What should they be doing? What support should they have? What links should there be? Where do they best fit? I think it works really well having them in Newport City Council. I think this has been a really great system. In other parts of the UK, they do sometimes sit in the NHS, sometimes they're part of the practice team. So there's lots of different models. And although there is work going in to make sure there's enough of them and they are in the right place because they need to be equally and fairly spread, you'll appreciate. I think that's a lot of more work that needs to be done at a kind of national and a regional level. Are you okay, Sarah? I was going to end on that question really, but more seem to keep coming in. What made Newport City Council want to put a social prescriber into practice? Um, I think you might want to blame us for it, really, mightn't you, Sarah? Really, I think one of us suggested it to a kind colleague who's on the call, and they took it to a meeting of very important people who kindly managed to make it work, really. So, and we've been very fortunate and privileged ever since. Last question then before the final comments from Mandy and then Sandra. Do you get more referrals now being based in practice than you did as a community connector?
No, I wouldn't say that we have more. I would say the way that they come in is different, obviously. But as in the community connector team, often will be accessed after maybe already the assessments that have taken place. So, for example, like a social worker or somebody's been to the GP and they've said, if you're socially isolated, go to a community connector. With me sitting within the surgery, often I'm sat there with them and I'll allocate an hour with them. I'll open up with the heart and the matter conversation, and there's a lot more to unpick. So, no, the referrals and the amount aren't different, but I find the amount I work with an individual, so the amount of outcomes are different to it when I was sat within the community connector team in Newport City Council. Yeah.
Thank you. Anonymous attendee, you've got some great questions. You can definitely come back to future webinars. A question back for ourselves, actually. Did we feel the place-based care team wasn't fulfilling the social prescribing role, and that's why we wanted Sarah? I don't think we would say it wasn't fulfilling anything. Place-based care, when it was first conceptualized, was imagined that I understand that I may be misrepresenting it, and it's not my project. I don't work for the health board. But it was initially aimed at trying to kind of think about how we support people socially and holistically, in an integrated way, but probably more at the kind of upper ages of life, above 65. Obviously, that population is growing in size, it's growing in complexity, but also you're most likely to be admitted to hospital above that age, really. So it had a little bit of a kind of hospital admission avoidance kind of slant. Um, there's always been, and I believe there continues to be, a strong link because of that fact with age Cymru. So there was always a little bit of a kind of support for 65 above. The wise, in our view, decision was taken a long time ago to say place-based care is for adults above 18. There could be some mileage in the future to thinking about how we think about young people and children and teenagers, but I think that poses other challenges, doesn't it, Sarah?
Yeah,
A lot more
definitely.
thinking there, doesn't it? But the principle of getting interested professionals in a room, ideally with the person too, as much as possible, to kind of think about how we all work together with finite resources, I think always is helpful. But clearly, as I'm sure everybody agrees, Sarah's done an absolutely fantastic job today of sharing and demonstrating and projecting what we've been able to do with the resource of Sarah 2 afternoons a week has been transformative. So I think I wouldn't quite say it wasn't filling something before, but we've been very privileged and lucky to have Sarah ever since. Did you want to come in there, Sarah? Sorry.
No, I'm thank you.
No problem. So, wrapping up, Sandra Chimarco, who conflict of interest declared, works for Newport City Council, says that the project links into the Welsh Government National Social Prescribing Competency Framework to develop learning resources for practitioners shared good practice across Wales. Sandra has also said, thank you, Sandra, that if anybody in the call or listening to the video would like service information included in the connectors directory, bulletins are
Yeah.
promoted publicly to Newport residents. The more that we know about everything that's going on, the more that we can give the right kind of package of support. Or widely within the integrated wellbeing networks, please contact. The email is community.connectors@newport.gov.uk.
Yeah.
And what a best fantastic place to end. Mandy Shine, who I have to say, A big thank you to on the call on the webinar because without Mandy and Sandra and Sarah and a great deal many people in the Integrated Wellbeing Network programme, in the Health Board, in the NHS, but also clearly Newport City Council have kindly supported this. Mandy's commented, not a question, but some general feedback. The value of the partnership and enthusiasm from Ringland Medical Practice has been key, thank you, in developing this work with local authority. The knowledge of all the services available locally has been key, and Sarah has been amazing. Absolutely second that in keeping up to date with this. A great example of partnership working. Well done. Everybody, that takes us up to around about 22. And as a webinar that is aimed at slightly at colleagues in practice and working in the front line. We know everyone's got busy lives. If you've got any thoughts or comments or reflections that you want to share after this, you can email Sarah and the community connectors on the email address that have been shared during the call. If you want to get in touch with us at 19 Hills CIC, best email address would be info at 19hills.org. If you've got ideas for future webinars, we're very open. We also run a somewhat regular podcast as well. And we just look forward to working with Sarah, Newport City Council, and all our partners on making 19 Hills the best place to work in general practice community services, which we know it is already. Thank you so much for your time, Sarah. It was an absolutely fantastic presentation. And we look forward to speaking to many colleagues on the call and others very soon. Thank you all.
Thank you.